Hey everyone, Tom Swirls here at tomswirls.com. I got a question regarding a friend of mine slash client explaining that he's getting wrist pain on the radial side, kind of around the snuff box area of the wrist from doing a lot of planche work on the parallel bars. So for those of you who don't know what a planche is, it's a push-up, but you're pressing from the hips so you can hover your body in the air. I'm also working on this too, but you can start to get some compression in and around this spot here because of a lot of weight going into that scaphoid and the radius and compressing this side of the joint. If you're doing the parallel bars, you're going to be more kind of in this neutral grip here. If you're using open palm on the floor, it can also still cause some of that, but it can also cause pinch here. So I'm going to show you a few exercises in which you can do to potentially strengthen or alleviate some of the pain, because when you're doing a lot of planche work, you're essentially shortening and compressing this side of the wrist where the thumb is, and you're overstretching everything on this side. So first of all, you want to make sure that some of the pain you're getting in the wrist is not neuro, because the radial nerve comes out of you got a posterior interosseous nerve, we'll get a little technical, comes out of the forearm here, but it also runs the back of the wrist around the thumb area. So you want to make sure that that's not nerve issues. So you're going to take your thumbs, place them into your palms, stand with feet together just to make it standard. Bring the arms back. So let's say it's the right wrist. You're going to ulnarly deviate the wrist, bring it back, lift it up slightly, and then side bend. If that reproduces some of the wrist pain, then you've got a nerve component, so strengthening and stretching this area is going to be not good. So we're going to want to do some nerve flossing in that, just to take the tension on and take it off. And you can hold the arm here, or you can bend the neck or twist. Whatever kind of brings that on is going to slide that nerve as it's supposed to. 10 reps over the next couple of days, a couple times a day, let's say 3 to 5 times a day should be suffice, and then recheck it. Sometimes when you just do this 1 set of 10, it might clear it out of the way, so that's good. So let's say it's not a nerve. Say we're getting some mechanical compression in the wrist joint. So we have to look at what is the movement that we're doing. Well, we're going into compressed radial deviation, and we're pressing from the hips, and we're creating a lot of tension on the back here. So we need to do essentially the opposite of that. So I'll show you on the right side. I'm going to use my band. You can use a dowel. If you've got a dowel, that works great, but I'm just at a hotel right now, and I'm going to show you how to do it with a band. So I'm going to stand on the band to get enough tension where I can lift the arm, and the band is just trying to throw me into that radial deviated position, and I have to strengthen and I'm actively stretching everything on the radius side, on the thumb side, and I'm actively strengthening everything here. So I'm going to get nice good posture. I've got my scap locked in. I can feel my lat working here, and I'm just going to do some repetitions back into here. Okay. A lot of the times, because we're doing the planche work, we're going to overstretch here, and the muscles don't know how to work in the short range. So we end up getting an imbalance at the wrist, which happens a lot, even just from everyday life, and we're overusing everything on the radial side. So pairing that up with a simple extension exercise into here can alleviate some of that pain. If you are developing weakness on the thumb side, on the radial side, you just take your band, bring the shoulder up kind of into the planche position, and you might just need to do an extra little bit of love for all the radial deviators. So brachialis, brachioradialis, and all the muscles that work in that position. Doing isometrics work really well here. So if you find it's uncomfortable going in and out, hold it in the short range, okay? Just to develop the strength here. Doing a little bit of supination, pronation, so that you have to kind of lock the wrist in is very effective. So I'll show you here. Okay, band's coming out of the thumb, and I'm just going to do some full supination. This is really going to lock in bicep, but it's also going to stretch the brachialis, which tends to get tight, and that can cause issues at the elbow, which then can affect the wrist. So we can work that there, and then we're going to go to the opposite side. So now we're getting a stretch, and we're going to work some of the pronators. Simple here. And like I said, you can use a dowel. If you're using parallel bars, using a dowel is going to be more specific to the tool you're using, but a band will work just as effectively. If you're doing open palm planche work, you got to make sure that that wrist extension is sufficient So you're gonna need to work on opening that up. But if you're using parallel bars, less need for that wrist extension and that open palm grip, and you need to work in strengthening here. I hope that clarifies any kind of issues that might happen around the wrist. If you're just getting wrist pain there and you're not doing any kind of gymnastic strength training, try these exercises. You'll find a huge difference. If you work at a computer and you're getting compression and you're trying to go to the gym and do some push-ups, make sure it's working. It's very simple, okay? If you have any questions, feel free to drop me a message and I'd be happy to shoot a video off and answer any questions that you may have. Take care.